How would you briefly describe your project to someone unfamiliar with what you do?
The WeCare project was enacted in 2020 to help seniors in Delaware 55 and above, to help keep them safe and healthy at home, and to help them manage their medical conditions.
What is the why behind your project?
When COVID hit, we realized that a lot of seniors couldn't go to their doctors, so a lot of them were home. Some they can't reach their family, they don't have anybody to talk to. And so when WeCare came to assistance, we were able to reach out to them. We were able to bridge the connection between them and their physicians so they can continue to receive the health care that they need. And we make WeCare available 24/7 for them to call, just in case if they need any kind of clinical support. So we were able to fill that gap.
What has worked well for your project?
What have really worked really well is for WeCare being available 24/7 because it's so difficult to reach out to the doctor's office after office hours. Even during office hours, when you call the doctor's office, they will have you leave message and they don't call you back within 24, 48 hours. But WeCare is different. WeCare, you will always have somebody to talk to 24/7, and they will always be available to help you with your clinical needs. And with that, we were able to prevent our members from going to the ER unnecessarily, and also prevent unnecessary hospitalization.
What are some challenges your project faced?
The biggest challenge we have right now is funding, and that's why we're here to tell our stories. So to see if we can have more opportunities to sustain the program.
How did you find appropriate partners/partner organizations?
When we tell our stories to our partners down in Delaware, like the Delaware State University that are doing our research, so they found the program very interesting. So they decided to partner with us so they can do some research to see how the program is actually benefiting the seniors. And their research outcome was very compelling, very encouraging. And we also have Highmarks, which is an insurance company. So they are helping us to see the trend on how the program has been reducing hospitalizations and reducing healthcare cost out there. So we also have, WeCare is under EHRI, the Educational Health Research Institute, international. So through that, WeCare was able to, I personally wrote a book for the seniors to help them, to give them the knowledge about their medical conditions, because a lot of them, they've heard about diabetes and high blood pressure, but they don't really know the pathological effect or the whole process and how it affects the body. So WeCare broke it down through this book, and they were able to understand, and that increases compliance with medical treatments.
What funding sources have you utilized or will you utilize?
Right now we only have ACL through the Innovation Nutrition Program. So we are hoping that if we continue telling our stories out there, so we will have more people to fund us and we can sustain the program. Because they really wanted the program, they don't want it to end. So, but we have to be able to fund it to keep it going.
How will this project be sustainable once your grant period is done?
Mr. Maya Gelly, is the president of EHRI. So I think some months ago, when we realized that we may be running out of funds, he voluntarily said that he wouldn't mind to sustain it financially until we can come up with another grant.
What stakeholders do you need buy-in from?
We need more insurance companies to really look into the program to see how it can help reduce cost, out of their pocket, because it's more cost effective, keeping people at home than for them going to the hospital unnecessarily.
What advice do you have for trying to replicate a similar project?
WeCare is a program that I wish would be in every senior's home throughout the country, anybody 55 and above. I wish the federal government can make this part of their benefits. They have Medicare once they turn 65. So I think everybody that has Medicare, Medicaid should have WeCare in their homes, because this is what other people rely on when their family are 1,000 miles away. WeCare is always available for them.
How do I get started?
First of all, we need to do a need assessment to see if this is actually going to benefit the people out there. And secondly, we need to have funding, because the people that are going to be delivering these services, they need to be compensated.
What do you wish you would have known prior to beginning the project?
I wish we would have done this 20 years ago, but it's not too late.